So we continue with the follow-up of patients that are having fractures. When you have any patient having fracture, the follow-up is divided into two: clinical and paraclinical. You follow up the disease that is fracture. So generally the follow-up you have to see is you have to follow up the vital signs within the day. You have to follow up for the complications, anemia. You follow up for say the clinical signs of anemia and all that. You follow up if the patient gets deep venous thrombosis and pulmonary embolism. So those are the things that you have to follow up. You have to follow up for neurovascular damage or not. Is it clear? Those are the things that you have to follow. And you have also the follow-up post-surgery, provided there is an internal reduction that is done and internal fixation that is done. Open reduction, internal fixation that is done. Those are the different things that you have to know in the follow-up. And you have also the late follow-up that you have to evaluate with this patient. The patient has to take rendezvous with the doctor and has to do other radiography. Is it clear? You can do a radiography at the normal period of the formation of the heart callus. Is it clear? In order for you to actually know that the heart callus should be formed. Normally, if you have a fracture, let's take an example: the fracture of the upper limb. Is it clear? If you have a fracture of the upper limb in an adult, is it clear? Fracture of upper limb in an adult. What happens is that on day one, you should do first two radiography. Is it clear? Day one and day two. So before reduction, you should do one radiography. After reduction, you should do another radiography. That's the second radiography. Basically, after reduction, you should do another radiography. Now, you should wait for the upper limb. You should wait till the time for the formation of the heart callus. Soft callus is not going to be seen on the X-ray, so you wait until the time of formation of heart callus. You do again another radiography at that period of time. That is in a normal follow-up. You do again another radiography in that period of time. Is it clear? So in that period of time, in cases of upper limb fracture, you see that normally upper limb is going to heal for 6 weeks in adult. Is it clear? So the heart callus formation starts as from 3 weeks. So at 3 weeks instant, you have to do again the third radiography in adult. Is it clear? Now, if you realize that the heart callus is not formed here, it means that there's already a delay healing. Is it clear? That is not a delay union, it is delayed healing. And if there is delayed healing, why you now ask now the patient now to start, you give now good counseling for the healing of the patient, calcium and all the different things that can be involved in the healing of the bone. So this is just called delayed healing. We just see if you don't see the heart callus at the level of the 3 weeks. Now the next one now is you have to see normal bone at the level of 6 weeks. Is it clear? If you don't see normal bone at the level of the 6 weeks, it's still called delayed healing. Is it clear? It is now called delayed union, provided you are already at 1.5 times this, that is 9 weeks. Is it clear? If you are 9 weeks, you are not yet seeing the formation of normal bone, it's already a delayed union. But here you just have the delayed healing if it's just above 6 weeks. So you just have to counsel the patient on the different factors that is going to promote bone healing or not. So those are the different elements that was involved in fractures. So from here we say thanks for your kind attention. Please don't forget to like and subscribe for our channel.